seems like we're in for a really, really busy season, and we will be coming into the respiratory viral season as well. And that kind of encompasses many viruses such as the flu, adenovirus, enteroviruses, RSV, and other viruses as well. So it's going to be a busy time. So, well, we typically start seeing flu cases in early fall, around the end of September or early October. And this trend will continue until the end of April, maybe early May, with a peak in between December and January. The reason why flu is a little bit more prevalent during these times is mainly because of the weather and human behavior. So the cold and non-humid air allows the virus to survive, and the cold weather forces us indoors, allowing us to spread viral particles easier from one person to another. So there are four types of flu viruses: A, B, C, and D. The first three can infect humans. However, the most important ones that lead to 98% of those diseases are A and B. So influenza A are most known to cause the pandemics that we see. And these particular viruses can infect animals and then jump over to humans, and which is why every 1 to 2 decades we get a epidemic or a pandemic, as we saw with H1N1 a few years back. It started off in livestock and then jumped to humans, leading to a pandemic. Influenza B viruses solely infect humans, and thus the chances of developing an epidemic or pandemic are a little bit lower. On any given year, it's estimated that influenza A accounts for about 75% of infections, whereas B accounts for about 20 to 25. And influenza A will likely peak between December and January, whereas B may kind of linger a little bit longer until the end of April and early May. It is also said that people who get infected with influenza A will have slightly more symptoms, whereas people infected with influenza B will have some ameliorated symptoms and not get as sick.